Welcome everybody to our first in a briefing series focusing on social affairs issues in the shadow of the coronavirus. As Israel emerges from this stage of the crisis, it is important for us to share whatever experience we can with our friends, hoping that it will help others with their own challenges. My name is Gili, Senior Director.
חכה יהודה, תחכה, זה עוד לא התחיל, שנייה.
לא התחיל, טוב, בסדר, חזרה גנרלית. שמעת אותי, גילי?
שומעת, כן, יש התנתקויות קצרות כאלה, אבל מבינים אותך. זאת אומרת, כן.
טוב, אני אבדוק את המחשב, אולי זה המחשב. Shalom. Welcome everybody to our first in a briefing series focusing on social affairs issues in the shadow of the corona crisis. As Israel emerges from this stage, it is important for us to share whatever experience we can with our friends, hoping that it will help others with their own challenges. My name is Yehudi Yaakov, Senior Director for Social Impact Policy at the Israeli Ministry of Foreign Affairs. And I'm happy to be also joined by colleagues from both our headquarters and missions abroad. This briefing is being carried live by New York and Paris. Following the introduction, our briefer will present her opening remarks for about 20 minutes, during which you are invited to send her questions via chat. We would appreciate noting your location and name with the questions. Today's briefing, in coordination with our Social Services Ministry, is with Gili Solovatshik, Director of Social Services in the town of Kiryat Yam. She took up this position in 2018 after filling a number of roles within the ministry and the private sector, particularly in the field of at-risk youth. I would characterize Kiryat Yam, Gili, please correct me if I'm wrong, as a typical mid-sized Israeli waterfront town with a heavy core of working folk. Like many of her colleagues in similar towns throughout Israel, the corona crisis required Solovatshik and her 90-person staff to move quickly to meet the basic needs of thousands of residents, as well as to create new volunteer units. Today, her team is handling an additional set of challenges. But I've spoken enough. Gili, the Zoom is yours.
Hi, everybody. As Yehuda said, my name is Gili Solovatshik. I'm a social worker by profession, and I want to apologize up front. I haven't spoken professional English for ages. So if I'll stammer a bit and I get stuck, please excuse me. I'll do my best. As I said, I'm a social worker and I'm managing the Department of Social Affairs here in Kiryat Yam for the past 2.5 years. Kiryat Yam, it's a beautiful city that I can say. It's located by the shore. It's a mid-town, it's a mid-sized city. We are about 50,000 residents here in the city. And I would like to start with describing something that happened last December 2019. In Israel, all the local authorities practice emergency practices, okay? We have a lot of emergency issues, mostly because of wars and bombings and stuff like that. And we practice all year long, all of us, all the city and municipality personnel, we practice how to deal with emergency situations. Last December, we had a drill, a big drill. Everybody in the city participated in it. We got excellent grades. We were ready. We practiced everything. We had everything set up. We met all the requirements that the emergency situations we practiced put in front of us. And then came mid-March and came the corona. Everything we knew about emergency situations was not relevant. We practiced how to go out to people's houses and meet them and help them and talk to them and hug them and kiss them and support them and encourage their families to support them. We couldn't do it. We couldn't go out to everybody. We couldn't take the natural support systems that the elderly, especially the elderly, had and use them. The families, even if they lived 2 blocks away, they had to count on us to supply all of their parents' needs in this time. That was one problem, that us as a municipality, everybody weren't. Nobody in the world was ready for it. But at the end of the line, we had to supply the answers. And we had to invent everything on the go. As we were advancing, we had to invent everything that we gave to our residents. That was one very difficult mission that we had. The other was that usually when you are in an emergency situation, you meet lots of groups, young people and old people, functioning people and malfunctioning people as a routine. In this crisis, in the Corona event, most of the people we met, surely at the beginning of it, were the elderly. And it doesn't matter if they were functioning as human beings before that, if they could supply all their needs before the Corona. All of a sudden, one day to the other, they lost all their functioning abilities. They couldn't go out of the house, they couldn't supply their basic needs, and they had to depend on others for everything. The young people at the beginning, young people, families, surely the young children and everything, and all the others, teenagers, they didn't have, at the beginning, they didn't have to rely on anybody else. Nobody understood that it's going to take a long time. So at the beginning, they were just going along with it. And the situation that the elderly were the only ones at the beginning that really needed our intervention, and we don't know all the elderly people that live here. We only know the elderly that used us before, that used our services before. We had to do two things at once: give an answer, supply their needs, and do a very thorough and quick outreach into the community to locate all the others that need our help and we didn't know about their existence. So one thing was the thing that we had to reorganize our own work. The other thing that we had to locate everybody that needed our help, and it's not something that we usually do so quickly and in such a wide scale. And the last thing was that all of a sudden, everybody stopped moving and lost a lot of the basic things that held them during the routine life. So many people lost their jobs. So many people became the new poor. All of a sudden, from being a family that held herself and functioned, they switched into being a non-functioning family, especially in the economic aspect. All of that together, if we could have time, a little bit of time to get organized, it would have been much better, but we didn't have time. And as an emergency answer, we had to improvise all sorts of answers that are not in our routine. For example, usually when somebody calls us and says he's in distress, he's afraid, a social worker talks to him and tries to calm him down and tries to find out what's wrong and how she can help him. We only had part of the social workers working, not all of them. So we had to rely on volunteers. My secretary, I'm telling you, she got a degree in social work the past 2 months because everything was, we had to improvise in order to give an answer, not by the means we usually use. I can say that Our routine work is our routine work everywhere. We give help to people in distress, to women in need, to families that need the intervention. This is our routine. We have social support, we have financial support, we give treatment to children, to couples. We do all that in our routine. And all of a sudden, everything that we know that works, we can't use it. I can't use face-to-face intervention with my clients. I can't go to the elderly people's house. I can't go in. I don't know what's going on in houses. I know that during the past 2 months, we had double the amount of referrals due to family violence in the family, abused women, battered children, double the amount of what we had all of last year, all of 2019. These past 2 months, we got twice the referrals. We got lots of calls dealing with the financial stability of families. Kiryat Yam, it's not a big town, and lots of our residents work in non-professional jobs, and those jobs were the first to be stopped. They lost their jobs, they got fired, and we had to help them go through this time without knowing for how long it's going to be. I think that one of the most difficult things for us was not knowing how long it's going to take. We're used to having emergency situations in Israel. We know we had this war and the other war, and we know to estimate that it takes a few weeks, sometimes a month, not much longer than that. The last war that we had at 2006, the Second Lebanese War, it was about a month. Tzuk Eitan in the south of Israel also was a few weeks. And here we came into a situation that we didn't know for how long we're going to have to keep up giving answers to people in their homes without the means to do it all through the way. I think that if I'm looking forward to what we're looking at, the exit from the crisis, I don't know if there's going to be another crisis or not. But what I do know is that it put two very important missions in front of us. And we're going to do them no matter if there will be another crisis or not. That's what we're going to focus on now. One mission is to try and reach all the elderly community that lives in Kiryat Yam. Kiryat Yam is considered to be one of the most old cities in Israel, if not the oldest. We have about 24% of our residents that are over the age of 65. It's considered to be a very old city. And as I said before, we don't know everybody. Not everybody needs me on a day-to-day basis. One of the missions we have is to reach all the elderly people in order to try and keep in touch with them on a routine base, so that if we have another crisis, doesn't matter what kind of a crisis, we can give them help. The other mission is to reorganize our emergency setup in order to be able to be very flexible and give an answer to different and various situations of emergency, because we only knew before war situations. The corona put in front of us a challenge to be able to adapt ourselves to different kind of needs of the community and be able to adjust ourselves ongoing to different situations. I can say that one of the most difficult things that we had to cope with was fear. The fear of the unknown, fear of people, not just of being, of getting ill or dying, but the uncertainty of the future was something that a lot of people felt very distressed because of it. And it was one of the main things that we had to cope with. And I can say that now, after it's a little bit different now. People go out to work, children can go to school, to kindergartens. We can feel it's better. People are less afraid, are less stressed. But I'm sure that if something will change in the situation in the near future, everything will submerge again and in a much stronger I forgot the word. Sorry. There's another thing that my team had to deal with. Lots of my workers are young social workers. Not just them, actually, me too. I have a family. Now, my family was in isolation at home. They didn't go out because it was dangerous. And I go out every day and I meet a lot of people. So I expose myself to danger and I expose them to danger because I go in and out of the house all the time. And every one of my workers, and me included, we had to deal with a dissonance of keeping our families safe and doing our job the best way we can. I can tell you that at least one of my workers told me, listen, I can't handle it. My husband, by the way, my husband too, he's my age, a little bit more. He's near the group that's considered to be, in danger of getting ill. It's very unstable for us as workers to expose our families to danger. And one of my workers told me, listen, I have 2 little kids. They have breathing problems. They have asthma. I can't come to work. I'll expose my kids to danger. And it's a very difficult thing for me as a manager to decide. I can't tell her, put your work in front of your family. On the other hand, I need her. And it was a very long discussion between us. How are we going to do it in order to keep everybody as safe as we can? We had to rely on volunteers for a lot of the tasks we had to perform. Ongoing, on routine days, our volunteers are mostly elderly people that have the time and the energy and the motivation to volunteer, and teenagers. And here, teenagers and elderly people, we couldn't use them as volunteers. The elderly people, because we'd exposed them to danger, and the teenagers, because nobody knew whether or not they are major carriers of the coronavirus, and because they were underage, they are under 18, teenagers, minors, we couldn't use them. And we needed dozens of volunteers to help us. So we had to recruit volunteers from today to tomorrow by the dozens to help us perform our missions. I must say that in this city, I know that in a lot of other cities as well, if there's one thing I can say about the Israeli people, that when there is an emergency situation, everybody enlists. And I can say that in Kiryat Yam, we recruited about 200 volunteers within a week. And they stayed with us for the whole time in a very intense work, day, night, mornings. They helped us distribute food and medicine and bring everything that people needed, bring to their house, bring to their homes. And we used them until the minute that some of them, lots of them, got back to work when they were allowed to go back to work. And the Corona crisis continued. So again, we were left, just my team and the municipality workers, the other municipality workers, to go on providing our residents what they needed, but the volunteers, they went back to work. And one of the main challenges we have for the future is how to develop and maintain a working, stable volunteer base. Another thing that I can say that is something that we're working on, we're asking ourselves how to deal with it when somebody is, is functioning on the border, and you all of a sudden you start giving him things, and you take away his ability to function by himself. It's something that people get used to very quickly. And even after we stopped distributing food, people went on coming to us and asking us for food. Before the Corona, they didn't need me. And now it's all of a sudden as if they lost the ability to take care of themselves. And I can see that that's going to be one of the things that we'll have to re-educate the clients here, our clients in the welfare services, to rely on themselves and to be self-sustaining and not rely on me to supply their needs. I think that cities that began the Corona crisis strong, sometimes I can even say that they had a worse time than me. Okay, when a city is very strong and very no, it's not exactly rich. Okay, but when the population is okay, the difference between what went on before the Corona and what the Corona brought them to is very big. And sometimes the gap is bigger than what happened here in Kiryat Yam. About 30% of the residents in Kiryat Yam are clients of the social services, always. So they know me, so they could come to me, and lots of them know that we help them all the time with various needs. And it wasn't such a big gap as it happened in other cities, that social services are just for, the very poor or very unfunctioning. One last thing I can say is that I think that the Corona taught us as an organization how to develop resilience. And I think that coming out of this crisis, it doesn't matter what will happen next, whether in 2 months, in 2 years, in 20 years. I think that the organization I work in developed resilience, especially in terms of flexibility. I think that all organizations, I could see it in the Ministry of Social Welfare, they answered our needs as a municipality in a very different way than what they did before the Corona crisis. And I know that some of the things that we did along the way, and ministries in the Israeli government did along the way, it's things that we'll have to preserve. I think that the Corona challenged us, and in a way it gave us an opportunity to check everything that we believed and we got used to, and we knew what we were doing and we were doing it okay. And this crisis challenged us to recheck everything that we do on a regular basis, on routine days, on regular days, and see if what we're doing is the best and if it's adapted to the population needs. I look at it, I know that in lots of countries it's terrible. Israel is relatively in a good place. Not too many dead. Everybody that died, it's terrible, but the numbers are not in thousands. And I know that a lot of us, I mean, lots of countries coped with it in a way that challenged them. I think that here, because of the way the corona occurred here, I think that the challenge is to see what worked and what was better in this time and try to preserve it. I can tell you, for example, one thing. Before the corona, I never knew Zoom existed. Not me, many of my staff, we don't conduct discussions this way ever. It's a wonderful tool. We think about preserving some of the meetings that today we conduct in Zoom because it enabled us, for example, to have a committee and everybody could talk, because when you talk in Zoom, you can't interfere. We had a very difficult discussion about a child yesterday that we had to remove from his home. And because lots of the participants were in Zoom, it was very quiet. Everybody could say what they wanted and everybody could be heard and nobody shouted. Lots of things that we learned during the crisis about the strength of our systems are things that are worth looking into, how to preserve them, not because we want to discard of what we did before, but we want to enlarge what we did before with different and new and improved methods.
Thank you, Gili. I don't know if there are any questions here. Let me ask you one. You have actually two hats when facing this crisis. You're both the decision maker and you're the person who actually carries out your decisions. I'm wondering, what did it look like, the cooperation between the government, nonprofit organizations, volunteers and so on, and the private sector on the ground in where you had to fight the virus?
Okay, first of all, I want to say that opposed to regular emergency situations where the social services are not the center, okay? In this crisis, social services were the center in every city. The engineering, everybody else in the municipality gathered around in here, and it happened in other cities as well, gathered around the social services because we were the focus. We had to supply nearly everything. So that was one thing that it's very important to say. In cities that it didn't happen, and the social services, and I know of cities like that they found themselves alone without the support of the other municipality functions, they crashed. Now, the government, it depends. I think that one of the things or one of the lessons that we learned is that there has to be one voice, one thing, one agenda coming from the government. We can't hear, as municipalities, we can't hear two voices. And I think, again, it took time for the Ministry of Health and the Ministry of Welfare and the Ministry of Education and the Internal Affairs. And it took everybody time to realize that they can't pull to different directions. Once they realized that, and they joined together, and they gave us the resources and the instructions, because even in crisis times, they give us instructions. They give us the policy directions. Once they realized that, it was much easier. I can say that in the beginning, it was very difficult because everywhere we turned, somebody gave us a different instruction or a different direction we had to go to, and it was very difficult. I can say that everything improved ongoing. I want to say something about the private sector before I'll go to the volunteer organizations and other organizations. I think that what happened, I remember in 2006, I was in one of the cities, I was a supervisor in the Ministry of Welfare, and they sent me to one of the cities in the north of Israel. And we relied and we got a lot of assistance from the private sector because it worked. And here, nearly everything stopped, nothing worked. So even when we needed help, it was very difficult to try and get help from the private sector. I'm not talking about resources or money or donations from the private sector. That always happens in crisis situations, and it happened now as well. But I think that even if I'm talking about volunteers, we are very close to a very big, to very big factories. Usually in crisis situations, I turn to the management and I ask them, and they send people to help us. We couldn't do it because people didn't work. Lots of the factories didn't work. And I think that another thing we have to try and do, if God forbid we'll have another Corona attack, I think that we can divert a lot of the working force in factories and in private sector organizations and companies that don't work. We can divert them to the local authorities in order to strengthen them. The same goes for non-profit organizations and volunteer organizations. Some of them stopped working because they didn't have the ability, the resources, or they weren't allowed to work. And I think again that they are very important. They are very important in the infrastructure of a stable society. And one thing I learned, and I can do it locally, but I think that if we can develop it to the national level, it would be much better. All non-profit organizations and volunteer organizations should be directed into the local authority, into the local municipalities. I think they can help a lot, and they are used to helping. Again, they are used to being an assistant to us on a day-to-day basis, in routine days, and they can help us in emergency situations if they would be directed towards it in a very decisive saying by the government and by everybody else that supports them. What was uniquely Israeli? I have a question is, what was uniquely Israeli about your efforts besides volunteering, which many states have? I haven't lived in other states. It's a difficult question because I haven't lived in other states. I can say that one thing that I do know about the Israeli society, that it's very familiar. In the Jewish communities, in the Arab communities, in the religious communities, family life and community life are something that is, it always happens. Everybody in small cities and in mid-sized cities especially, maybe less in big cities, but in Israel, a big city is not, it's not very big. And Israel as a whole, everybody knows everybody. I think that the community life that was affected because of the crisis and because of the isolation that was forced on us, I think that it's something that really shook everything that the Israelis believe in and stand for. And I think that the ability of the Israelis to cope was compromised because of it. And it took days, maybe even weeks, to reestablish that community commitment one to the other. And once people realize that even if they're closed at home and they can't go out and they can't go see their parents and they can't do anything, but they can contribute one to the other, you know, my neighbor next door, somebody that lives across the street from me, talking to people. I think that one of the things that's very unique to Israelis, that they get organized very quickly to help in crisis situations. I said it before, I think that every military situation we were in proved to us that we collectively support one another very quickly. There was one other thing, somebody asked me before, one of my workers asked me before, if I think that there can be riots in the streets in Israel, if the corona isolation would have continued, if the economic situation would deteriorate, if I think that riots in the streets are possible. I don't think so. And I think that's one other thing that's very unique for Israelis. I think that there is a line that Israelis, because of the way that everybody knows everybody and they give others support, I think that it's a line that Israelis won't cross. I don't remember ever looting in Israel, for example. I don't remember. And if something happened like that, it was very, very unusual. My main advice for other countries and the new poor. Okay, my main advice, I think that checking everything that our systems in the municipalities and in the government do, rechecking them in light of what we needed to cope with in this crisis, just sitting down and taking everything that we took for granted till now. The way I built my teams were built in a certain way. And last week, I took all my team leaders and we sat down and we started checking again the way that our structure is, our organization structure is, to see if it suits what we have to give to the community. If it's all right that I have 2 social workers for that, for the elderly and 2 social workers for children. If it suits what now, after I saw what's going on in the city during this crisis, if it's right, and if not, how do I change it? I told you before, doing Zoom meetings, it's something that we're gonna adapt because it helps. So I think that rechecking everything that we thought is right and everything that we got used to, that's my main advice. And about the new poor, since the second week of the isolation orders in Israel, somewhere in the middle of March, lots of people come to us and say, listen, I lost my job. Now, it's not that before those people were rich, okay, but they managed. And all of a sudden, one of them lost their job, the other spouse, his income decreased in a very massive way. They can't handle themselves, they can't cope. Now, it's not that they are poor forever, they don't come from poverty culture. And they won't go into the poverty. They won't develop the poverty symptoms of poverty culture. but they are poor. Now they are considered to be poor, and they have to reorganize their lives in order to cope, and I have to help them do it. For example, rethink their occupational path. I told you before that lots of the residents in Kiryat Yam are non-professional workers. So I have to help them maybe gain professional education in order to change the way their professional stability holds in the next crisis that comes. Give them new and improved ways of job seeking, something that they didn't need till now, because they got a job and maybe they left the job and got another one and they left that. They moved around, and now in order to create occupational stability, they'll have to change the way that they organize their lives. And moving from the status of being okay to poor for a short time is one thing. Moving from the status of being poor now to living a poverty culture is another thing. And I have to be very precise in the answers I give them and the assistance I give them, in order not to enable them to move from being poor now, today, for a period of time, to moving and being and living poverty culture synonyms. Okay. Usually, there's a question here, which is a great one. Does everyone in Israel follow all the rules set by the government? I think that Israelis have a difficult time answering that. Israelis have a problem. They know black, they know white. The gray is a bit difficult. So long as they told the population, stay at home. Most people stayed at home. And during that time, they told them only go out to buy food. So they only went out to buy food. Don't go to the beach. So long as everything was very decisive and very clear, Israeli population as a whole, apart from certain groups, but as a whole, yes, people followed orders and instructions. I think that one of the problems is, the problem is that the minute that the instructions were not very clear, there was a lot of gray there, and something that you can decide about, you as a person can decide about, it got to be a little bit of a problem. I can tell you that when I go out to the commercial center out here, I can see that a lot of people, they don't wear masks. We have to go out with masks all the time. I can tell you that here, inside my department, it's a problem. People come to meet us. I invite them to have a meeting. They come without a mask. Now, what am I supposed to do? I'm supposed not to let them in. Let them in, give them a mask, and then what do I do? It's a problem. I can tell you that I think that it's a problem. I can tell you that in the local municipality level, the supervisors that we have and the municipality supervision, they circle around the streets and they tell people, put your mask on, put your mask on. Don't let people into your store if there are too many people inside. They do it all the time. Sometimes it helps. They have to do it over and over until people will understand and do it. Again, I don't think it's because Israelis are disobedient. I think that because all of us have to learn from the beginning things that we're not used to, and we don't know how to handle them. I can tell you in person, it's very difficult for me to see my brothers, because I met them, and not hug them. And we, all of us, it's something that we're not used to. you know that the distance between Israelis is very narrow. Israelis stand very close to one another. They talk very close to one another. They touch a lot. They hug a lot. It's something that is very strange to us, and we have to relearn different method of behavior. About teaching people to rely on themselves from the beginning, to re-educate them. I can tell you that 10 days ago, until 10 days ago, we gave food, cooked food, to thousands of people in the city. 10 days ago, we told them, everybody that we gave food to, we told them, listen, one more week and that's it. And everybody had to understand that we're going to stop distributing food. Now, a lot of the people, especially the elderly people, they called us, what do you mean you're not going to give us food? So how are we going to get organized? So what we did is we took 3 supermarkets in the area. We arranged with them that between the hour of 8 to 10 in the morning, 3 times a week, only elderly people can go in. And we told the elderly people that, listen, you can go out, go to the supermarket, 8 to 10 in the morning, just you and other elderly people. There won't be any teenagers or any women or any families there. And it helps. We used a lot of volunteers and my workers to assist people that, there was a family that got a family of 7 people, 5 children. They were afraid to go out of the house and they had financial issues, and they expected me to go on giving them cooked food and food. So my worker went there and met the wife outside of the house, and she went with her to the supermarket, and she practiced with her again how to go out of the house and do her own shopping and provide for herself. Somebody called us and told us, listen, for the past 2 months, you brought me my medicine. Now you have to go on because I can't go to buy in the pharmacy. I can't go there. So they said, you can. I'll come meet you outside. I sent a volunteer there, and he met him outside, and they walked. They didn't go by bus because it's too dangerous for the elderly person. They walked to the pharmacy, and they went inside, and they bought his medicines, and he walked him back to his house. I think that re-educating people in crisis situations is something that has to be done individually most of the time, because you have to make sure when somebody is in distress and is stressed and he loses his functioning abilities, you can't rebuild his abilities collectively. You have to do it differentially according to his difficulties and his needs and his strength. How do you see French responses? I can tell you something about France. One of the things that happened during this crisis, that apart from hearing about other countries, I think that one of the things that happened to us during crisis situations is that we close in. We take care of things that happen to us, to the people near us. Now, where I sit, I know about France and what happened in France and in Italy and in Spain and the United States from a distance. I don't know about the way that French people, the French government coped with the Corona situation, but I think that as a world, there's no one way that is right. I think that one of the things that all of us has to do, like we are doing here, me and my fellow directors in the other municipalities, we are meeting next week in order to try and dig out from each of each of us has an experience with the things that worked for him and his city, and we want to dig out those experiences and try and share them in order to learn. I think that the same thing that we're doing in the municipalities level will be done in the national level in Israel. I think it has to be done in an international level. I think that that's the only thing that in the end will establish again international resilience. About the volunteers.
Gili, can you just repeat the question, Bella?
Okay, there's a question here that I said that one of the challenges I had was to establish a stable volunteer unit. And how can I do that if I don't really know who will be out in the next crisis? Who will be out, okay? I know one of the things that we will have to do is build an ongoing preservation actions for volunteers. Because if I'll recruit, I have 200 volunteers now. I have another 100 that are elderly and about 200 youth. If I will wait to use them in the next crisis, I don't have a chance. But if in a month from now, I'll call them in, I'll give them small missions during the way from now forward. Every week I will give 10, 20 volunteers small missions that are connected to welfare and to community life. The next crisis, maybe I won't have all of them, but I'll have part of them. In a month or so, I'll gather them out here till 50 people. I can do it. I don't know what will be the number in a month, but let's say 50. I'll call 50 of my volunteers out here to the field next to my department, and I'll just meet them and I'll see how they're doing, how they got organized, if they got back to work or not. How can I assist them, and how can they see themselves in community life ongoing? For example, I asked all my volunteers, I asked them to think about it before they give me an answer. I said, next to you, a house, 2 houses next to you, there's always somebody, an old person that will be happy if you will call him once a week. And every Friday or every second Friday, you'll bring him a flower and talk to him for half an hour. Who wants to do it? Now, I asked them to think about it for a few days. I got so many answers, and I'm going to take all those people that volunteered to do it, and I'm going to start working with them and connect them to elderly people and do a follow-up every time to see that they are doing it, that both sides are happy. I will never know who's going to volunteer the next time. I can't know it from advance. But if the baseline of volunteer work in the city is strong enough, and the variety of volunteers will grow, and there will be more kinds of volunteers, I think that it will help me in the future, no matter what kind of crisis will be. In Honduras, the people sometimes think that there is a political element to the matter and that not everything that is said is true. But the economy is declining, and there is a problem between doctors and economists about the revival of the economy. There are already many layoffs. Okay.
It's not really a question for your expertise, I think.
I don't know how to react to that, to relate to that.
Let's give the questioner an opportunity to. That question came from Honduras. Do you want to ask a more specific question to Gili? I see no. All right, Gili, I think we're going to end it up here. It's been a fascinating discussion with you, and you've shared a lot of your expertise, and I'm sure that everyone, the participants, will take away, and the people who will see this afterwards, we'll be able to take away something which we all hope will help them fight Corona as we fought it ourselves. So again, I want to thank you. I want to thank the Ministry for Social Services for their cooperation, and my colleagues at the Ministry of Foreign Affairs, particularly Itai Milner, who without whom this wouldn't have happened at all. So I thank you very much, and have a healthy weekend.
Stay healthy.